I want to acknowledge the traditional custodians of the land on which I currently live and work, the land of the Marian people, and pay my respects to their elders past, present, and emerging. Marian country is in the East Kimberley of Western Australia, and which I am grateful to be a guest. I consider my home, where I lived for over 25 years and where I completed over a decade of medical training, to be in rural New South Wales. Professor Joe McGurr may remember me as the medical student who thrived in Notre Dame's Rural Clinical School of Lithgow. It's where I completed my final year of medical school, where I birthed my own first child, where I was mentored by some excellent rural generalists. It was in Lithgow that I cemented my desire to become a rural generalist. Rural generalists are the only medical specialists, and I use that term purposely, the only medical specialists who provide unmatched continuity, the diversity of clinical skills to work across several disciplines to meet the needs of a whole rural community, from womb to tomb. I worked across 15 different hospitals in New South Wales, and along my travels I visited several towns to ask them, what advanced skill do you need? And the resounding answer that I had at the time was, we need obstetrics and emergency. Maternity care will always be a very special skill for me. Not only are you a part of the powerfully bonding transformation that women experience when they become mothers, you're also helping to ensure that these women are birthing safely, on country, surrounded by their family, their support network, their community. You're also ensuring that that hospital is not just a place for the sick and dying, but a place for new life. Pregnancy is not a disease, but birthing requires excellent evidence-based care with inbuilt continuity, and rural women deserve this safe space close to home. Despite 30% of our population living outside metropolitan centres and contributing over $500 billion to our economy, we seem to be centralising healthcare. Half of our rural maternity services have closed since 1990. That's over 140 rural maternity units that have closed. Trainees have said to me that training in rural generalism in New South Wales, and in rural obstetrics in particular, feels like a pathway to nowhere. I completed my obstetric training in Taree, and I started to look around to see where I could practice my skills. Gloucester lost its maternity service within weeks of me starting my GP training. Scone, where I lived and worked for 2 years, is slowly losing its maternity numbers, often with no theatre cover, no epidural service, and fewer births than I could afford. In my attempts to try to get a position at Kempsey, where I applied twice and failed, I tried to get some shifts at Port Macquarie Base Hospital so that I could get to know the specialists there and they can get to know me and understand my skills and my motivations. I had done several weekends at Port Macquarie Base Hospital that went quite well, but one weekend in particular was rather busy. We had a shoulder dystocia, we had 2 postpartum hemorrhages, we had 2 instrumental deliveries that I managed alone. I had the skills to be able to do that, but then on the final night I had a premature delivery that was less than 32 weeks, beyond my scope as a GP obstetrician, and I felt that it was safer for me to call for help. Unfortunately, the help responded by saying, you should be able to deal with this alone, and perhaps you're too junior to be working in a level 4 hospital if not. That was my last day in Port Macquarie Base Hospital, and probably the last time I could ever hope of getting a job at Kempsey. Unfortunately for rural generalists in New South Wales, it feels like there is a deep hierarchy where we are viewed as unsafe and the lesser or the poorer younger brother of our non-GP specialist colleagues. At times when I was upskilling or doing skills maintenance at some of the other tertiary referral hospitals, I would receive comments like, oh, a GP obstetrician, so when are you planning to specialise? Don't waste your skills in general practice. You could become a specialist with us. You're working in the middle of nowhere, so you probably don't have much support. Why would anyone do that? Seems like a bit of a comedy, but actually I find it deeply upsetting that a skilled GP obstetrician who had the qualifications to be working in a rural hospital that's on the brink of closure was blocked twice, that the recruitment for the GP obstetrician in a rural site is being controlled by the referral centre where there are specialist obstetricians. Irony is that these specialist obstetricians actually can't work in a small rural area like Kempsey because they can't resuscitate a baby and they can't work in primary care where that service is really needed. They've blocked a GP obstetrician from working in a rural area, but they themselves don't want to be working there to replace them. I think it's a shame for women who 200 of whom are going to be displaced to birth instead of birthing on country close to their home and in their community. I'm going to say this again, a rural generalist is a specialist. A rural generalist has the skills to keep an entire hospital and entire health service working because of the diversity of our skills and our ability to be able to mould to the needs of a community. Our administrators and our hospitals need to be held accountable for the units that are being closed down when there are solutions available. We need to decide whether our rural population is worth supporting and whether care close to home is worth supporting, or whether we're going to continue to hemorrhage doctors to other states. Sorry that I couldn't join you in person now, but I'm actually on a flight on my way to Sydney. I will be at the conference dinner tomorrow and I hope to see you there. Thank you so much to Joe McGurr and to Gurmesh Singh for being there, and thank you to RDA New South Wales for your advocacy and for your support of rural journalists.